Hi everybody. Again, this is Beth Strachan. I'm with Metropolitan Group, and we are one of the communication consulting firms that works with Robert Wood Johnson Foundation's Research Evaluation and Learning Program. And I'm really happy to get our training series for researchers kicked off today. I will be doing most of the facilitation today. I do want to introduce my colleague, Nora. Nora, do you want to say a quick hello?
Hi.
For today, what we wanted to focus on was really around exploring ways to better engage change makers in actually using your research and evidence to inform the systems change that we're looking for, the public policies that we want to change that can affect people's health, equity, and well-being. This is the first in a series of tools and trainings that the Robert Wood Johnson Foundation is bringing to the Research Evaluation and Learning Program. So we're excited to get that kicked off. Thank you for being our first test subjects. And as you go through today, a couple things I would love for you to think about. One is the level of information that we're providing today working for you? And then also other ideas about specific things that you'd be looking for trainings. We have the next few planned, but we're looking for additional ideas. So let's dive in. Our objectives for today, we're going to talk about how to get your research where it can have the most impact. And so we want to focus on the highest value audiences and channels. We want to share some examples that actually came from even some of the folks on the call today. We're going to spend a little bit of time giving you some theory, but then we want to break you into small group breakouts. So that you can workshop ideas for your research, and then we can come back together to discuss your key takeaways and questions. In advance of this meeting, you should have gotten an email prompting you to come prepared to talk about a specific project and some key questions to consider, and that's what we're going to focus on in those breakouts. If you did not get, I sent it out via email to one group middle of last week and a couple people yesterday. So if you didn't get that worksheet, please chat your email address to Nora privately, and she can email it to you while we're going through the rest of this content. But what we really want to, we're hoping that you come out of here today with a more proactive communication plan for your research. We want to help you boost your ability to communicate your findings across settings and purposes and audiences, kind of, the getting your research beyond the journal and into action to advance health equity. So why disseminate? We hope that you're passionate about your research and the discoveries that come out of it, and that's why you do what you do. Your findings obviously are an important contribution to the field, which means we need to get your findings into the hands of those people who can actually use them for action. And I think all of you who've been invited are part of one of the 4 action programs of the Research Evaluation and Learning Program. So I am going to drop a question into the chat right now, which I'd love you to just take a moment to answer. And that question is, what is the change you wish to see in the world by doing your research? So take just a second and drop answers into there if you wouldn't mind. I'm hoping that you're all typing madly. There we go. So from Will, better policy decisions. Yes, thank you. And from Catherine, more equity, both health and social equity. I think that's great. Other folks, if you're still typing away, please keep it on, keep on keeping on. As a grantee of RWJF's Research Evaluation and Learning Program, like, we know that you share our commitment to expanding that evidence base, not just having the evidence, but expanding who it gets to, and then impacting the many factors that shape health. And what also, to Will's point, like, what are the policy and system changes that can have the greatest potential for impact. So your research and how you get out in the world often models what it's mean to embed equity into research, was something I'm personally passionate about. And so this is conversation that seems really critically important right now. So in terms of thinking about dissemination, we want to have you start with the goals, right? So a couple that we would throw out there are research that reaches people whose work would be informed by the evidence we present. So obviously, if you're in a journal, it's impacting, I mean, it's reaching a lot of those folks, but who are the other folks that we can get out there who can actually put it into use? And then ultimately that your research is informing the nation's evidence base on issues of health and equity. When we think about goal setting, we also think about setting communication goals that are appropriate for the audience that you're trying to reach, and that's also achievable. And I'm curious if there are other goals that you might throw out here for research communications, and if so, you can also drop those in the chat. So let's talk about audiences for a second. And we can also do some popcorning here. So who needs to think about your work in order to actually move it to what we call the for action? You can either drop those in chat. Some of the ones that we think about are obviously the researcher community, so that you all know what other folks are learning and doing as a result. Think tanks, I think, are part of that. Those who work on governance or advisors for your coordinating center, partners, funders, and prospects for your work. My cat is going insane, sorry, in the time of Zoom. What are the policy and systems change decision makers that you want to reach? But also, who are the field that can use that, or who are the grassroots organizations who often serve as those intermediaries between your work and the policy or systems decision makers? And who are the opinion leaders who can also get your research out there in a bigger way than any of us might be able to do so alone? I'm curious if anyone has additional key audiences that you'd want to think of, feel free to throw those in the chat. One thing that you might have noticed is that we didn't list mass media as an audience in and of itself. We encourage you to think of media really as a channel to tell your story to those audiences, not an audience in and of itself. But one of the reasons that we wanted to bring up media here is that there is an incredible opportunity a lot of times to wrap your findings into a more general story or commentary about an issue that's really topical. And sometimes that might mean even delaying some of your research because you know something's going to happen that you can tie into. And in addition to thinking about the audiences, we also want you to think about what is it that you actually need to know about these audiences in order to speak to them most effectively. So what is it that you want them to do? Who are their influencers? Who do they influence? What are their current perspectives, or how receptive are they going to be to what your findings are, or how skeptical are they going to be about what your findings are? What is their level of expertise on the topic? Are you going to have to explain things and why it matters to the work that those people are doing, or are they already going to be deeply versed in what you're talking about? What are their values and motivators and drivers, or even barriers to wanting to hear what your findings have been? And what are the most effective mediums to try and reach those folks? Is it the New York Times, or is it a Journal of Public Health, or is it going to have a one-on-one meeting with them? How much of a priority issue is this for them, and what all are they going to need to know to take action? Is it just your research? Is it something much bigger than that? Is it putting your research in the context of their body of work? These are all of the things that we want you to think about when you're thinking about the audiences. And as you're thinking about that, that can help informing your key messages for your research. So as you publish a manuscript, it's got everything in there in the deep way that you need it to. But then we often need some help translating that into key messages for those key audiences that you were just thinking about. So when we think about message framing, what we really mean, we're sort of simplifying it into what, so what, and now what. And that can be your catchphrase questions as you think about what the message framing should be. In terms of what, we mean like what is the meaningful context for the issue, and how can you define your finding or the problem that your research explored? What did you learn? Or if your research isn't complete yet, what are the key questions that you're asking, and what are the early insights that you might be able to share? In terms of the so what, it's like communicating your issue's relevance to your audience and their stakeholders. How can you articulate the benefits to the people, to health equity in what you're finding, and what does it matter, and why is this a pressing question, and again, what insights does it hold? And then the now what is a meaningful call to action. What is it that you want them to do now as a result of the data that you're able to share with them? In terms of customizing those messages, you want to write for what you know about that audience based on the questions that we just considered for audience mapping. So what kind of context do they need? What values can you speak to that is going to make this relevant to them? Remembering that not every audience that you talk to is going to be as deeply invested in health equity as their priority as you might be. So can you talk about framing it in a different way? Is this about human potential for growth and success? Is this about what's possible in our country, particularly in this moment as we're looking at a response to COVID and racial injustice, and in many places in the country right now, fires as well? What about community and connections, the connections among the folks that you're talking to and the interdependence of our society? Or is this around loyalty to your community? And also, how can you customize the calls to action that you need from that particular audience? Always, we want to eliminate jargon, and we want to write for comprehension. Sometimes I feel like researchers think they're dumbing their work down, and I assure you that's not the case. And even in Nora's and my work, we're very often trying to write at a relatively low grade level, not because we don't think people are going to understand, but just because we want to make sure that they understand it quickly and that they're able to remember it and repeat it. And when we have some jargony language in there, it can be harder for them. Particularly when you're not writing for the academic community. One of the examples I was looking at was a research report I recently read, and they had the phrase contagious presenteeism. And I was like, I sort of get what that means from reading the context of the report, but I think most humans out there would just understand that as showing up to work sick and risking infection to your coworkers or to your customers. So while contagious presenteeism might be a perfect thing to put in your report, when you're trying to pitch that to someone else, you might want to use language that's a little bit more accessible. As a preview, one of the things that we'll be sharing as a tool soon is like a one-pager on how to make your research findings accessible. Be concise and clear. Can you summarize your findings in a page? And can you refer people to more deep publications or detailed publications if they want more information? And always think about what the 1 or 2 key facts are that you want people to remember. So if you're meeting with an advocacy organization, or you happen to see the executive director of an influential organization in the hallway somewhere, you know, imagine what they would be able to put on their palm. And that's what they're going to remember, not a whole one-page brief. So think about how you can keep this concise. And then often, how can you use charts or graphs or illustrations to convey key points? In your manuscripts, there's often the data graphs, but is there a way to translate that into something that would help be a visual guide for folks? Getting beyond data and stats. So we'll ask folks to think about what the human-centered approach is to sharing your story that can demonstrate the findings or outcomes that you have gotten to. So tell stories if you can, and sometimes that means telling your own story of what drew you to the research and the question. I'm going to put into the chat a link to a blog post that Chris Lytle from Systems for Action wrote recently. There we go. That's in the chat now. If you haven't seen it, I encourage you to check it out, where he really got personal about why he did the work. And this was in the context of trying to promote a CFP that Systems for Action was putting out. So, you know, that could have been a really boring post. And I think Chris made it both meaningful and something for people to get excited about. There's a couple of, that's one last thing I was going to say is think about whether or how to mention Robert Wood Johnson Foundation's funding. So you should have clear direction on this from whichever For Action program funded you. But if you're not sure, you can also check in the RWJF communications toolbox. There's a Get Started button in there that you can use. And I will share that link with you later if that's not something you're familiar with. And as I say all this, because this is a lot, I also just want to underscore that, like, you obviously still need the appropriate methodology and the rigorous and unbiased research and the detailed data to back up your findings. That is still something that we absolutely respect, and we understand how critical that is. Everything that we're saying in here is really just about how to illuminate what you found to make it useful for some of the audiences that you're going to want to reach. Tactics and tools, I think, is something that most of you are more familiar with and thinking through how to get your research out there. So when it comes to having findings, you can do direct outreach to some of the folks that you know we're going to care about. That might be some of the folks in the community that you've engaged in your research. It could be someone in an organization somewhere that you know is going to be able to use this research. There's various kinds of collateral, one sheets, fact sheets, briefs, all those kind of things that can get your manuscript into a more digestible print presence. Digital communication, so how can you break down into social tweets or threaded posts that can briefly communicate parts of your research in order to tell the larger story. There's a few folks that we've worked with who've done some paid posts or placements to get the word out there. Public relations is kind of the umbrella that we'd throw out there for media relations, community relations, public affairs, etc. A lot of you are already doing presentations. Some of those presentations are for the academic community, but think about places, are there conferences for the folks who will ultimately use your research where you might be able to go speak to them? And then can you use associations that you have in terms of their email lists or newsletters or social, etc. These are just the means or the tools that deliver the message to the right person at the right time. And the caution I would throw out to this group is sometimes people think about what the tactics should be before they think through what the goals are, the audiences are, or the key messages that they want to share for those. Last but not least, I would just say sometimes think about building a following for your work. You know, how can you become an expert resource for journalists and others who will use your research? How can you build a following in one social media channel? How can you kind of tease out or tee up early findings so that you've got an audience that's sort of built in and ready when your formal publication comes out? I will also give an advertisement here that RWJF is offering a webinar on working with the media to speak a little bit more specifically about that. It's on September 17th in the afternoon, and toward the end of the webinar, I'll give you a little bit more detail about that and a link to register if you're interested. I was just going to share a couple of quick examples and then we'll break into the small groups. So one was on sharing the effects of minimum wage related policies on health. So with funding from Policies for Action, Michael Reich of the University of California at Berkeley found that he did a study called Minimum Wage Policies and Vital Health Outcomes. And he found that non-drug related suicides declined significantly with higher minimum wages and earned income tax credits in those communities. And this was especially true among women. So super cool findings. He consulted them with Policies for Action and RWJF's legal department for some guidance and tips. And then he was able to cite his research at a testimony for the House Education and Labor Committee on how gradually raising minimum wage is good for workers and it's good for businesses and it's good for economy. And then he later published a piece in NBER, and he launched a multi-platform dissemination strategy that got the attention of a whole lot of different kinds of stakeholder groups. And the research was ultimately featured in articles in major media outlets. The Hill published an op-ed on it. And then the researchers also wrote a commentary and recorded a podcast episode for VoxEU. So lots of ways that this research can have impact. Sarah Brandspiegel on the phone knows about this one, how you can tap networks to promote the connection. In this case, it was between TANF and health improvements. So the S4A team in Philadelphia that was led by Mariana Chilton, they found that low-income parents participating in temporary assistance for needy families, TANF, you might know it as, they experienced sustained improvement in food security, caregiver health, employment, and savings, along with decreases in depressive symptoms. So again, super important findings, particularly as we look at recovering from COVID. So in this case, to support the dissemination and translation, the team created a steering committee at the start of the project to help guide the analysis and disseminate the results. And then members of the committee who were program participants, experts in behavioral health and TANF policy, and state representatives provided feedback on the findings and supported the development of a couple of policy briefs. They also received some media attention for that. And then they shared the projects through a national network called Peer TA, so that they could reach the practice community and national conferences and among leadership at relevant government agencies. So just a couple other brief examples. One of the Evidence for Action grantees was working on a comprehensive approach to tobacco policy in the age of e-cigarettes. And so she's been having virtual meetings with public health departments to discuss tobacco control policies. So doing the direct outreach to a key stakeholder audience who can actually put that into work. And then also from E4A, the research team behind the Stable Schedule study to promote low-income worker health and well-being, they found that improving schedule stability in the retail sector means better sleep for sales associates. And the study was conducted at Gap Inc. And the researchers worked really closely with this corporation, the Gap, both to do the study and to share the findings. And so they were able to kind of have the weight of the Gap's name behind the research that they were doing. And then as a result, not only did they get the study into the New York Times, but they also presented to the San Francisco Office of Financial Empowerment, which is where the Gap is headquartered. And then the reports themselves were circulated really widely. So it can be done, we believe it. Before you dive in and start talking, I would encourage you to take just a brief moment to kind of think about if you did the advanced work, fantastic. If not, take a moment and just think about the project that you're wanting to discuss and how you might be thinking differently after what we've covered in the last half hour. All right, I think that brings everybody back. Hi, y'all. If you want to go, we're a small enough group, I think if you want to go ahead and unmute yourself, that would be great. And I just dropped a couple of questions into the chat. And again, with this smaller group, I think I would love to know, any feedback you had about doing that exercise that might be helpful. What did you learn as a result of doing this exercise, and what felt the hardest in doing this exercise? And then if we've got enough time, if anyone has any specific questions about projects that you're working on, we'd be happy to address those too.
I could start.
Go for it.
So in our group, we talked about the current grants that we're working on and some of the projects that we have and some of the challenges for disseminating study findings that we've encountered. And I think it's somewhat of a similar shared experience in that sometimes you could have a lot of interested, so there were several ones. One of them was, how do you identify the, sort of your stakeholders? And that is, I guess, for the most part, not as hard. I think one of the hardest ones that we were discussing is how do you of all of the people who might be interested in your research, which of them do you reach out to? And then even if you know who to reach out to, or sort of what organizations to reach out to, how do you know exactly what person in that organization you should reach out to? So like there's sort of different levels of like identifying all of interested parties, which are the ones, you know, you possibly cannot reach out to every single person in this universe, right? So how do you target that group better? And then, you know, conditional on having that more targeted group, how exactly do you reach out to the more relevant people in these organizations? So for example, one example I gave is like, you know, child welfare agencies in different states, which would be a relevant party for one of my studies here. Like who do I reach out to? So anyway, yeah.
So one of the things that I try and look for is like, is there like a wholesaler for those folks? So is there some sort of conference or community where child welfare folks convene? You know, there are a lot of those kind of what we call the umbrella organizations where you might have a chance to reach a whole lot of them at once. Or just trying to figure out which are the ones where either you know this is a really strongly aligned priority in terms of policy change. So child welfare, of course, is so broad, and I'm sure the research that you're doing is more specific to something. So is there an organization that's working on that specific thing? And that might be another great place to start. And then when I do this kind of outreach from my own work, a lot of what I find is like a game of trying to identify maybe the program director at the right kind of organization. And I'll just either see if there's someone in my network that can help get me to that person, or just even cold calling them. And oftentimes people are kind. Like this is work that we're doing and people tend to be passionate enough about it that they're willing to help you out. And even if they're not the best or the right person to talk to, they'll often say, oh, but you know who you should talk to is Nora Wiedemeyer over at Metropolitan Group. So I think it's like trying to figure out simultaneously where you can reach the mass of the people interested in your issue, where you can find a specific connection based on a priority that they're working on, and then trying to find that specific person and then just kind of play that game of telephone from there. But I agree, it's hard. Even in the work that we've been doing with the pillars on some of the bundles of work that they've been doing, where they've taken maybe 3 or 5 studies on the same topic, and we're trying to tell a broader story than any one of those research projects. And then when we've been coming up with these lists of folks we want to get to, they're quite long, and I don't think any of us have like an existing database of the right people at those organizations. And so it can be a little bit of work to try and curate those lists. I'm curious if any of the other researchers on the line have additional feedback that they would offer.
I think, hi, this is Megan Shepard-Bannigan. I'm at the VA and at Duke. You know, I think I kind of, something I learned, I actually did most of the talking. So Joe, I don't know if you have anything to add as well. It was sort of hard for me to kind of articulate, like I know who my partners are, or I know kind of who I want to reach out to, but there's so many different, like in some ways it's like, what's the ask? And I felt like I had a hard time kind of articulating what that was. And clearly the ask changes based on who it is. But, you know, I'm really interested in thinking about how the results that I got from my study can be translated into something that, you know, is actually used by the system and is sustained over time. And so, you know, how to sort of target the right people to do that. And then when you do, like, what is the ask of them? I mean, people are passionate in the VA, but it is also, it's a health system too. So I think there's a lot of other priorities sometimes than translation of research, you know, to be perfectly honest. I mean, I think that there's a lot more crises on a day-to-day basis. And so it can be hard to know kind of how to effectively get people's attention.
Yep. You just made me think of a couple things. One is on the latter point, it is trying to find within a system, especially one as complicated as the VA, who is working on this. And sometimes just starting with their external, and for any big organization, starting with their external affairs or public affairs department, because they're often not going to say, oh, sure, I would love to help you get your research out there. But they probably have a finger on the pulse of what's happening across the organization, because they're kind of the filter through which a lot of their own organization's work goes through. So they can also be helpful there. Do other people have feedback on that particular question, or just areas where you sort of got stuck or where you're not sure what to do that we can try and brainstorm today? Okay, I think we're good. All right, thanks everybody. Have a wonderful afternoon. Bye.